This is Dr. Antolak from theGentlDentist.com in Shelby Township, Michigan. 586-247-3500 is our phone number. And I'm going to just talk a little bit about what TMJ is, as everybody refers to as TMJ. Well, TMJ is actually a jaw joint. It's the joint, as I'll show you on this skull right here, is the joint between the upper jaw here and the lower jaw here. Okay? And so what happens is people, if you get a clicking in your jaw, that has to do with the cartilage disc that lies between the lower jaw and the upper jaw that clicks. But also, TMJ, what people think too, is an issue where they not only have pain up in this area and the clicking, but also headaches. And so it's a whole syndrome. It's called TMD, which is called temporomandibular dysfunction, which is more broadly defined. But right now what I want to do is basically go over some of the issues that you can have with your jaw and why it clicks when opening and closing wide, or why you have some pain maybe in the jaw joint. The temporomandibular joint is the most complex joint in the human body, and the reason why that is, it has a couple of different functions. One function is it's used to just rotate like this. Just when you minimally rotate your jaw like this, it just acts like a hinge, like a normal joint on the body. But then here's the special part about it, is when we've been designed so that if we, obviously if we can't get a whole lot in our mouth, if we can just do that much. But if we need to open up real wide, what happens is our lower jaw will start shifting forward. And I'm going to try showing a smile here. As we open wide, our lower jaw will start shifting forward, as you can see right here. And right on here, how our jaws are designed is there's a disc that sits between them that traverses and goes right, if everything's functioning normally, that disc itself will go right along with this lower jaw here, with the joint. It's called the condyle, and it will function smoothly as it goes up and down. Literally the jaw joint moves forward and backwards right with the jaw does with the disc itself. Now, what happens when it clicks is part of that disc, literally, not the whole thing, but some part of that disc will actually come off the joint, and it will shift forward, and then you close back and it shifts back on. This disc is actually contained and supported by ligaments which are attached to muscles. So if you get a lot of stress in your muscles, or if you clench your teeth, then those muscles become activated and hyperactivated, and that hyperactivation makes these very sensitive, and so they shorten up real fast, and that is what can create this the jaw clicking. And so, for example, if this is I'm going to show, this is the lower jaw here, and this is the upper jaw, which I just showed you. So when you first start off, your jaw rotates like this, okay, no problem. Then you have to open up wide, your jaw comes down like this, like I just demonstrated. If you start moving forward and that disc between it, part of it snaps forward, then that's that clicking you get. Then you start moving back a little bit as you close, then it snaps back on. And so that goes back on and off and on and off. And so that can become a problem. So what we need to do many times is to relax the muscles in there, and we do that by using bite splints or something called the NTI, things that can prevent the stresses from going on within the joint itself and within the muscles that support that jaw joint and that support that disc. As we relax those muscles, then they function more normally, as long as there's not too many problems that have taken place. Now, with that being said, there are some people who do have some more issues, some problems with their jaw joint internally, and that's the internal joint. So what I do is I have here just a patient that we've seen before in the past, and what I want to do is show you a CAT scan that's made of that joint a little bit more close up. And what it will do is will show you the space that's in there is where the disc will actually be. So right now within this CAT scan, we've got 3 different planes. Right now this is the view, which is looking, if we took a section like this and just took a section cut through here, you can see the jaw joint here and the jaw joint here. And if you look right here, this is that part here, which is called the condyle, which is the top of it here. That's what this is, and that's what this is right here. Now, as we move up and down, as we move this angle like this up and down, you can see how this is changing. And so as we do that, you can see how it's changing its shape. Okay? So now as we go up further, now it's getting into the jaw space right in there. Now let me show you something right in here. This view here is showing a section like this. Now this section is showing which is more than what I was just describing, is showing, this is my hand here as I made in a fist here, this is my hand as I cupped it. This is the part of the jaw joint from side to side, from the right side to the left side here. And now, as we move it forward and backwards, we can see the positioning of this. And what this does, this actually allows us to see if there's arthritis, in this space here, or if there's any attachments of bony attachments and things like that that can create the pain in the jaw joint itself. And so as we go through it, we can see on this patient, at least on this joint, it looks pretty healthy. There's a nice space, as we can see here. Let me make this a little bit larger. As we look right here, there's a space between here. So this is the space where the jaw joint is actually sitting in, which is the disc is sitting in this space here. That's why you can't see it. And it continues as we go through here. As you see that, you can see there's a space between the whole thing. All right? Now, on this view here, which is interesting, now we're looking at it from this view here. And so on the scan, this part right here is actually this. Okay? And this part right here is this part right here, the top part of it's called the maxilla. So you have the superior part and the inferior part. And this is where the jaw, this person here, normally this jaw sits up in this region here, but to take this scan, he had to move his jaw forward a little bit, and you can kind of see right now where this is positioned. This jaw was fitting here, and now it's starting to come forward a little bit. If it's unhealthy, this disc is going to slide forward, and this space is going to get closer and closer, and even grind, and it even can be bone to bone here. So this is the anatomy of the jaw joint, and a CAT scan like this is really nice because it gives us some abilities to see the health of the joint itself, and if there are problems that can't be resolved easily, if we do a scan like this, then we can figure out there might be an anatomical reason for that. Surgery is usually the last thing that anybody wants to do for these, because it just makes it much more difficult, and you can become more debilitated with doing surgery for the jaw joint. So we try to do much more conservative treatments, like I said, splint therapy with bite guards, adjusting the bite, things like that, muscle relaxant sometimes, and that type of thing. So I have quite a bit of experience with this type of dentistry, so if you do have some jaw problems or headaches, clicking in the jaw, please feel free to call our office in Shelby Township, Michigan at 586-247-3500. Thank you.